I'm Natalie Cassidy, and I was lucky enough to land my dream job, aged 10, on hit BBC soap opera EastEnders. I've only ever had one job, but I've always wondered what I would have done if I wasn't an actress. Now, I'm a mum in my 40s. I've left Albert Square and I'm ready to embrace a new challenge. Day one at college. Can't quite believe it. Doing something I've always wanted to do. Training to be a carer. I'm absolutely petrified, but I am determined to do it well, give it the best I've got and see what happens. With an ageing population, it's estimated that over half of us will need care in our lifetime. I'm absolutely shattered. It's hard getting old. At a time when there's a shortage of care workers, I'll be heading back to the classroom. Mummy's first day back at school. And gaining on-the-job experience on placements. Over. Go! I'll hear people's stories firsthand.
It's not fair. Life's not fair generally, is it?
Share their heartache. It must be such a tough job for you. And determination.
You see the real difference in people's lives that you can make.
I just hope I've got what it takes to care for people from their first days to their last moments. Right, lanyard. Check. I honestly must have checked through my bag to make sure I've got everything about 100 times. Today is the start of my second week at college, studying for a BTEC in health and social care. Oh, I heard you. You're right.
Yeah, good.
Good. I'm rushing out the door. Week 2.
All right.
Go.
Well, good luck.
Thank you, darling.
All right. See you later.
See you later. Have a good day.
See ya.
Bye. Last week was really hard. Starting a new challenge, not knowing how people were going to perceive me, remembering people's names, new teachers, new place, new environment. There was a lot to take in. But I'm really looking forward to getting back into the classroom with the students. I think we all got on in week 1, so I'm really looking forward to getting stuck in. The course is an introduction to caring, and each week we'll focus on a different stage of life. Did you have a good evening? Did you feel rested?
Yeah.
Starting at birth and finishing with end-of-life care.
Morning everyone. So today we're going to start looking at some childhood illnesses. This obviously follows on from looking at babies and growth and development.
Today's class will be looking at childhood diseases and how to prevent them spreading. I mean, childhood illnesses, we've all been there. There was a really, really scary time where Eliza couldn't control her temperature and it just rocketed to about 40.5, 41. And she did have to get rushed to hospital because there was just nothing I could do. And that is very, very scary. Anything that helps to stop children's illnesses, I'm all for that. Young children can have up to 12 viral infections a year. This is due to their immune system still developing and because germs spread easily through nurseries and schools. Whilst most illnesses are not serious, some still require hospital care.
Just going to turn the lights off. So we're going to have a little bit of glittery hand gel. This is taking the place of germs. We're going to use the torches and see how well you have washed your hands.
It's estimated that over 80% of infectious diseases can be spread on our hands, so correct hand washing is vital for healthcare workers. Sounds like a simple task.
Oh,
I scrubbed them though.
I did.
I thought I washed my hands really well. I thought being one of the eldest in the class I would have been tip-top, but no, I failed miserably.
Oh no, Elliot. Oh no, Elliot.
It's in the little creases.
I'm Elliot, I'm 17 years old. I'm studying health and social care because, I don't know, I just feel like I like to look after people. I remember in primary school, I would get the role of looking after the receptions and just helping them about and stuff. Having that caring role just felt right for me. And I do like the idea of being a nurse.
Okay, so what illnesses can be prevented by vaccinations?
When I joined the course, I didn't really know if I would get on with people very well.
Measles.
That was something I was worried about. So for us to have such a strong connection so quickly means a lot.
Well done.
Rubella.
What's the ones you get when you go to another country?
I genuinely cannot remember. I really can't remember what I had. Time for me and the other students to learn more about the diseases under the microscope.
If I just give you all a slide each and have a look at some different illnesses. So this is tuberculosis.
I reckon the last time I was in a lab was probably about 1997 or 8 at secondary school. Oh, that is good. It almost looks like a painting. There is something just exciting about using a microscope. I don't know what it is, but it just makes you feel clever. It's quite clear. It was a really, really fun, interesting session. And knowing that my second placement's coming up with the children's community nurse, you know, it's fascinating. And I'm realising how many different roles there are. You know, before starting this, I'd go, oh, OK, paramedic, nurse, doctor. But really finding out about those niche jobs, you know, community nurses, you have social workers, healthcare visitors, school nurses, diabetes nurses, and I'm sure there's so many more. I've come to meet the children's community nursing team in Watford. So the first placement is under my belt, on to the second. I'll be shadowing community nurse Charlotte.
One of us will go and get the patient and then we'll go through to next door.
Feel more confident and looking forward to meeting new people, but I have been told it's blood tests, which is my worst nightmare.
So we would put the tourniquet on, find the vein, wipe
it.
We use such tiny little needles. And then tourniquet off, needle out, plaster on.
I know how much I hate blood tests, and I know I'm going to be seeing little children have them today, and I'm not sure how I'm going to cope with that because it is very upsetting. All right, yeah, ready to go? So I'm just going to have to see how I get on.
Shall I race you? Shall we race?
I know
Who's going to win?
Who's going to win?
I'm quicker.
Ready, go! Go, 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 go!
4-year-old Rayan was born prematurely and has chronic lung disease. He's here for a routine blood test.
Oh, you beat me.
When I saw little Rain running down the corridor, this tiny little dot, I just looked at this poor little darling boy and thought, oh no, got to have a blood test. I'm going to go and wash my hands, and I bet you can't be on the chair with your sleeve up.
On the chair.
He might be a fast runner, but he's not going to be ready. When the children have hurt themselves in the past, I can put on a very good, brave face and saying it'll be all right and you're really brave.
He's ready.
You beat me again! I think that is something, hopefully, I can take forward with the blood test today. You beat me again!
I don't want to do the shark.
Once you do this, I'm going to race you. And we're going to have a sticker after as well. I think I would have this bus with the flowers on it.
That is pretty cool.
I like that one.
I'm going to have a dump truck.
The dump truck.
Promise. Shall we use the cold spray? Can I do it on Charlotte first? Do Charlotte.
Oh, I want that.
So cool. Shall we do some spray? Ready? Ready?
No way.
It's so freezing. It will be over so quick, Rayan. So quick. You're okay.
Darling, if you look up here with me and then we can think about our race. I hate needles. I hate blood tests. I was watching a little boy being absolutely petrified.
They're not nice.
It's all right, darling. It's all right.
To see him so scared really hit a chord with me. It's all right, my darling. You're nearly there, sweetheart, and we're going to go and have a race.
It's okay.
You're okay.
You're all right, darling.
You're okay.
Butterfly in
That
your
is
arm.
so,
I want a
so
butterfly in my arm.
brilliant.
Such a
Won't be long now.
Wow.
Done, done, done.
Oh, done. Well
Very,
done.
very
Shall we
brave.
do another day?
Charlotte was brilliant. The whole team were great.
Let's have another race.
Okay, ready?
Another race.
Yeah.
Oh, you got a head start? That's not fair. I can imagine it being very, very tough for them. You know, child after child after child being upset and scared, which is a hard thing to do, I think.
Wait for mummy.
I may have conquered one fear today, but I'm about to face another. Placements are a chance for students to learn on the job, and the team are keen to teach me how to do a blood test myself.
We would normally get the students to do a blood test.
Jessie, that's
I hate having my bloods done. I hate it.
yeah.
It is a reason, genuinely, that I thought I might have another baby. How bad is that? Bloods and cannulas, can't bear it.
Maybe we
You
should.
can do Charlotte's blood. Or Alicia, she's got really good veins.
This could be a disaster, really. I'm thinking, am I really going to have to do this?
So if we pop the tourniquet round first.
Here-ish?
Yeah.
That feel too tight?
That's
Is that
good. Yeah. And then just have a feel.
Fine.
Very hydrated. And then we just give it a wipe.
Oh, of course, yeah. Okay.
And then take the top off and then just go in. And then you'll see it draw back here.
Fine.
And then once it's drawn back, we can take it out. We won't.
Okay. So that's, I'm just remembering. So like that.
Yeah, and then it doesn't even need to go that far in.
Here-ish.
Yeah. And then just push it. And...
But I need to take this off now.
Yeah.
Scared. I am scared. You're very good. There?
Yeah. And then just push it. And then...
That's it?
Yeah, it's drawn back. So then we're done.
Yeah!
There we go.
So exciting.
It's amazing.
I can get rid of that.
I did it. I can't believe it. I never, ever, ever thought today I would be confident enough with a small needle to be able to draw blood from somebody. It's a massive thing for me. But it was a very big vein.
It was very big.
Everyone has.
Yeah.
Very exciting. To say that I've been able to take someone's blood today, I'm well pleased. I really didn't think on a placement this early on, I'd be so hands-on with somebody. If I'm doing that now, what will I be doing towards the end? It's amazing, really. I feel very proud. I've really loved being with you today.
Thank you very much for
Really
coming.
have, honestly. Thank you.
Thank you.
Oh. As well as working in clinics, community nurses also provide a vital service visiting and caring for chronically ill children in their homes. For my next placement, I will be working with Charlotte again, but this time on one of her visits. You know, I've been so lucky because my kids, touch wood, you know, are very healthy children, and I've been fortunate enough to continue my life and carry on working and, you know, socialising and doing the things I love to do as well as being a mum for them. Some people don't have that opportunity and their world completely changes and they can't work or they can't enjoy things that they used to do. Their whole life becomes their child's illness. Before going on the home visit, I want to get some advice from my friend. It's lovely today.
It's so nice.
Who has first-hand experience of community care. Abby is a dear friend of mine. She's a school mum friend for the last 5 years. And my Joni and her Ariana just clicked and we couldn't pull them apart from each other. And then one morning, Abby messages me saying, Ariana seems to be in a bit of pain, not sure what it is. Ariana's pain worsened over time. I had a voice note of Abby talking to me about how Ariana felt and I could hear Ariana screaming in pain. So she, you know, went up to the hospital, got a scan, and then her life changed forever. We had a message which was just Abby saying Ariana's got cancer. And it was very hard. Very hard. Because you just don't expect that when you have a child of that age. And it's their best friend. and your friend. It was just horrific. Yeah, horrific. It's your worst nightmare. Yeah, it's been a really, really tough 5 years. But yeah, it's getting there, and Ariana's amazing. And she's healthy, and she's having clear scans. When you watch a friend go through what they have, it really does change your perspective on everything. You just don't realise how lucky you are to have a healthy child. When I heard about the children's community nursing, I know that Abby had a team that helped her and her family through the darkest of times. And when Ariana was receiving her medication or lots of bloods were being taken. So to talk to Abby about it and her give me a little insight into how they helped her, that would be brilliant. So what do you think about me taking on this health and social care course? Do you think I'm mad?
A little bit, but you're always mad. But I think it's genuinely, I think it's brilliant.
Because you had a lot of community nurses, didn't you?
Yeah, weekly, sometimes even consecutive days during a week. So when Ariana was initially diagnosed, naturally we was at Great Ormond Street, and then they put us in touch with the community team, and they were so helpful. Going home, obviously, was like a massive shock because we have to look after Ariana from home.
Yeah, of course.
But the community team contacted me the next day. They even they visited the school and had a talk with all the students about Ariana losing her hair. They really were like family, because it was always the same 3 or 4 ladies that came. We kept Ariana calm, and it was all just a familiar face. That I cannot rave enough about our community nurses, how important that job is. They were really vital to everything that we went through. They were amazing.
I am feeling very excited about going out with the community nurses. What do I need to... Just give me some tips on how to be.
One key thing is what you do naturally anyway, is building rapport and having that rapport with us as well. So, when Ariana wasn't in the room, they would ask how our kind of mental health is, but also having that little bit of knowledge, understand to a degree their diagnosis and what it is that they're going through.
Do your homework. I just hope that there's time to do that in that setting. I can imagine they have so many people to see.
Yeah.
I think it's going to be quite an eye-opener. Well, thank you for your advice as always.
No worries.
And
hopefully I helped.
You always help me. Abby has given me really good advice. And I think the things I'm going to take away are to be kind, to keep calm, but to really do my homework.
Thank you.
On who I'm going to care for. And I hope I make her proud. Having cancer at any age is absolutely awful, but childhood cancer comes with its own problems and just additional needs. And around the UK, there are so many projects that help children with cancer and families out there. And one of the projects that I want to highlight is in Northern Ireland, and there is a lady doing such a great job, and I want to shine a light on her. There are around 1,900 new cancer cases among children in the UK every year.
Hello.
Okay, Mr. Ford, how are you?
How are you? Molly's mum, come and take a seat.
In Northern Ireland, 9-year-old Molly was just 2 when she was diagnosed with cancer, and her primary school have played a special part in her recovery journey.
Molly started primary school when she was still receiving chemotherapy, but it became very apparent very early on that she was struggling to communicate, and she was diagnosed with selective mutism. Molly, because she couldn't talk, it was very difficult to make friends. And it was when Molly said to me that she couldn't use the school toilets because she was scared that if she got locked into the toilet, she couldn't shout for help.
Yeah.
And I think I realised then that we did have a problem.
Oh, Molly, look! He's so excited to see you.
To help overcome her selective mutism, Molly started having visits from Sharon, one of the 3 million people volunteering in health and social care across the UK. She adopted abandoned Henry from a Shanghai rescue centre.
He had a broken back, he had open wounds, and when he was well enough, he flew to Northern Ireland. Hello, everybody. We started to visit a few schools. When they see Henry running in his wheelchair, it's uplifting. And when they hear of Henry's story, there's always some wee aspect of Henry's life that maybe makes them feel, oh my goodness, I'm not so different after all. Oh, Molly, he is glad to see you. It was very hard to begin with. Molly wouldn't make eye contact. Obviously, she didn't speak. Henry, he's being so, imagine sticking your butt in the air like that, Henry. Really rude behaviour. So Molly and Henry shared a very special bond, didn't you?
Yeah.
Because you'd both been through a lot together.
Yeah.
And did you feel a bit sad for Henry sometimes?
Kind of, because he has to run around the fields. He could like feel trapped sometimes.
And as the weeks went on with Henry, I could just see physically in Molly how she was starting to relax, and she was just growing in confidence.
How precious is that?
Sharon has allowed Molly now to develop and to be able to talk and to be able to socialise and have friends and do things that I never imagined Molly could do.
She's chatting away now, and from what we hear, Molly didn't really shut her mouth during the wee session.
Just a wee Speedy Gonzales.
I always want her to have the same opportunities that she would have had pre-cancer. I don't want cancer to define her.
Sharon and Henry Wheewheels are unsung heroes, like millions of other people who go out of their way to care for others. You know, when I look back to Ariana's illness and Abby and the family, that would have helped them so much. And it's just amazing to see all of these projects and how much they help families and children with cancer. Back in Watford on this week's placement, I'm out on the road with children's community nurse Charlotte, who's doing some home visits.
Thank you for having me.
Thank you for coming. How are you feeling?
All right, a bit nervous.
Yeah. Do you like feel more nervous about those home visits?
I think going into people's homes is different to a location setting, be it a hospital or a clinic. I feel like that's, you know, not only an honour, but you want people to feel comfortable with you.
Yeah.
In the UK, there are thousands of children's community nurses like Charlotte, whose work helps keep children with complex illnesses at home with their families and out of hospital. An approach which not only benefits them, but frees up desperately needed hospital beds.
When I was doing my training, I knew I wanted to go straight into communities. I just love, especially with children, when you go to their home, you just see them, like you said, just completely relaxed because they're in their safe space.
How do you find it if a situation is very serious, life-threatening, and you get to know a family? How does that affect you? How do you not get close to people?
You don't go into nursing if you don't care.
Yeah.
So you're always going to get close to people. The way that I can deal with it the best is by making sure that I know that when I walk away from there, that there's nothing more that I could have done for the family and the patient.
So where are we off to?
So we're going to see Iris, and she is 6, and she's got leukemia.
Okay.
She's about a year and a half into her treatment.
Right.
So she's in what we call the maintenance stage. So we just see once a week for bloods.
Okay.
And she will probably be going to school straight after our visit.
Right.
She's got a twin. Marcy may or may not be there.
Charlotte, obviously I'm just shadowing you today.
Yeah.
But I really want to help you. So what can I do to help?
Well, it's always good to have a bit of distraction.
So nice chat with
just chatting with Iris and
Iris.
Yeah.
Let me get that right, for goodness sake.
And then if
Iris.
Marcy's there.
So Marcy could do with a little chat as well. Okay. I'm looking forward to seeing how they deal with Charlotte turning up, because obviously she'll have a relationship with them. Right then.
Ready?
But rather than that scary room at the clinic, is it now scary people coming into their space? And I'm, you know, a bit nervous about that.
Can you take some? Give me them. Is that all right?
Hopefully I can use what I've learnt from Abby.
Hi.
Hello.
How are you?
Lovely to meet
Nice to meet you, dear.
Really
Thank
nice
you.
to meet you. Abby's words were really ringing in my ears. I really took time to introduce myself. Lovely to meet you. Thank you for having me. Natalie.
Hello, you.
Yeah, how are you? So I wanted Mum and Dad to feel comfortable with me being there. Hi, Iris. Hi, Marcy, aren't you? And I really wanted to play with Marcy. Wow. So what do you have to do with it? You tell me.
Are you still doing your TikTok dances?
Yeah.
Liv was saying that you was teaching her last week.
I could see straight away how relaxed the family were with Charlotte. It was just like a friend popping over. And I suppose that's the goal for those community nurses, to feel like a friend, to get on with the tough stuff.
Iris has a port. What side is your port, Iris?
This one.
This side. The good thing about the port is when it's not accessed, you can just keep going, don't you? And just pretend like it's not there. So we'll take the numbing cream off and then we'll access her port and we'll just take some bloods.
Iris's port is a device placed under her skin, giving easy access to her bloodstream for both blood samples and chemotherapy. I am familiar with that, purely down to seeing Ariana with her port. Drawing from that, I know that it's uncomfortable, painful. So while Charlotte was getting on, I wanted to distract her and try and, have a chat with her and make it go as quick as possible for her. What's your favourite colour?
I think you like the blue one.
Pink.
No.
Oh, it's okay.
You sure?
It's okay. You're fine. You're fine. You're fine.
Done.
Fine.
Oh. There we go.
There you go. Well done.
Worked?
You okay? Yeah.
Has pink always been your favourite colour?
It worked perfect today, didn't it? It was very well behaved port.
Very nice.
That was so good, wasn't it? It's so great.
Plaster?
I don't know how, as a children's community nurse, you don't get emotionally attached to these kids.
You okay?
Can I find something?
You did so well.
Oh, look.
Something I've learnt, knowing how Abby felt with Ariana, is how much a child's illness affects everybody in their life. So going in to see the twins today, I just wanted to have that moment with their mum to say, how are you?
She's so brave and she is. Really she's amazing. Beautiful girl she has. You do. You really do. Thanks. She's braver than I. So,
But you've got to look after yourself as well.
Yeah.
The community nurses are so good with all the family.
Yes.
They include Marcy,
as
and that's
well,
important.
And everything.
Yeah.
It can be very difficult, especially for so small children. Yeah, I mean, we had amazing help from them.
Are you going back to school now, Iris?
Yeah.
I think it's lunchtime now, so that's a good time to
Perfect. You'll go back for your playtime and lunchtime.
There we go.
So the end of week 2, I've absolutely loved it. It has been emotional and upsetting at times because you're dealing with children, but I really feel like I've learnt loads. The children's community nurses do an absolutely stellar job.
We will see you soon.
Thank you very much.
See you later. Bye.
I've always had my eye on caring for older people. I never knew that I would find children's nursing as special as...
You take care. See you. Really nice to meet you. Pleasure. All right. See ya.
Bye.
Bye. But watching them in action, making kids happy as possible in terrible situations, and the thought they give those families and the empathy they show, it really makes me realise that is a very, very special job.
The longer we hold on to our emotions, the more of a toll it takes on our bodies.
I remember in a paper, I was 12, 13.
Terrible.
And a grown man called me a beached whale.
That's really bad.
Neurodiversity is part of our community, families, it's part of the world we live in. It's really common.
Do you mind if I crouch here?
Yeah.
It was the first place everybody understood. And they made me a cup of tea and I cried and they said, this is completely normal. Everybody cries. Everybody cries.
Step into the shoes of a carer in the Open University's interactive care home. Scan the QR code on screen now or visit connect.open.ac.uk/Natalie Cassidy to explore how you could make a difference.